Should you create 30-minute sessions, 45, 60, 90-minute sessions inside your PT practice? Well, none of those really matter, and that's not what your patient wants, and I'm going to describe why that is in this video. My name is Dr. Garcia. I help cash-based clinicians just like yourself improve patient satisfaction and thrive in business. When we look at how much time a patient wants or needs, typically, if you look at any cash-based website, typically says one-on-one with a doctor of physical therapy for 1 full hour. That's typically what you see. The reality is the only reason you offer that is because in an insurance world, you were given 15 minutes, 30 minutes, 45, or an hour. And that was purely because of insurance-based codes. They required you to be 8.5 minutes, so you rolled them over to 15 minutes, and that allowed you to think that time was critically important because that's what was billed. So the insurance company was saying, I need you to spend 30 minutes of manual therapy or Therex, whatever it is, on their care, and that's what we're going to reimburse you for. And so you thought as an insurance-based clinician that the patient needed more time so you can deliver on what they need. I understand that. So you then took that same model into a cash PT practice and you said, well, great. They were limited on time before, 15 and 30 minutes, and that's only what the insurance covered. I know the solution. I'm going to bring over to cash and I'm going to give them 1 full hour with a doctor of physical therapy. Let me guess, that's probably what your website says. Now, here's the problem. When a patient, it goes to an insurance-based company, they're looking for a solution, right? They're looking for an answer to their knee pain. They're asking for help to figure out what they need to do in preparation for their marathon. Then you as a clinician, you're trying to figure out, great, here's my solution. When you look at what a patient wants is, how do I get to my marathon without knee pain? That's what they're looking for. You as a cash-based clinician haven't really understood that. So instead of giving a time to complete that, how many exact weeks it's going to take to get there and how many sessions it'll take, you can't forecast or project that. So what you do is you charge per hour, hoping that each one of those hours translates to improved outcomes and then getting to the race. So for instance, if a patient comes to you and they said, hey, I want to be able to run my marathon in 12 weeks without knee pain. You say, fantastic. I'm going to charge you 60 minutes every single time you come in and hope that you get pain-free. Instead of saying, listen, for 12 weeks of care, it's going to be X number of dollars, $1,000. And that is your rate. That's what you charge. Instead of saying that, you don't say 12 weeks for one fee to be able to get you there. You say, I'm going to charge you $150 every time you come see me. I don't really have a plan to get you there. I'm then going to charge you $150 every single time. Now, here's the question. What if you can charge $150 and only see that patient 25 minutes and get the same result? Does the patient want the full 60 minutes because that's what they're paying for, or is that the model that you created? And if you can get it done in 30 minutes, would the customer be just as happy? Would they actually be happier that it doesn't require that many visits or that much time? Or what if you can do 30-minute sessions with virtual check-ins and a couple programs to create 12 weeks of care that didn't require 12 full hours? My point to this is that the patient isn't looking for time. They're looking for a solution. And because you are going in and using time as your motivator, well, of course, they're going to try and leverage as much time as possible. So the critical piece here is not to focus on time. Focus on the solution. How long is this going to take me? 8 weeks. Great. Inside those 8 weeks, we're going to get you solved with no knee pain and you'll be running your marathon. Now, if you want to create a worst case scenario, go down to the minute-by-minute play on exactly how many minutes it's going to take. And that's why the patient expects you to go the entire hour. Why? Because you make it about minutes. Don't make it about minutes. Make it about the solution that you have. So if you have a knee pain and you have a marathoner, then create a marathon knee pain program that is 8 weeks or 12 weeks, whatever that is. Create the solution there. Don't make it about 12 hours. Shorten it down. Have 4 virtual sessions, 2 in-person sessions. And that allows them to see the value in what you do, not how much time you give them. So get away from the insurance-based model and create something unique inside your private practice. So you're not trading every single minute for $1. You're now creating a solution that the patient now understands that regardless of how long it takes, I'm committed to these 8 weeks to get me to that point where they need to go. That will create success instead of going minute by minute, charging exactly what you were doing in the past. And the only reason that you're doing that is because you're used to the insurance-based model. get out of that model and come over to see something unique so that you can be more successful, more profitable, hire more staff, see more patients, and thrive in business. Now that's the approach that you need to take inside your clinic. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.